Hello everyone, it's Dr. Gary Fetke here from Tasmania, and for many years I've been trying to work out how we can prove that a state of nutritional ketosis and a ketogenic diet can be safe for ourselves. And in the last couple of years I've become a grandfather, and I observed my daughter, who runs relatively low carb, struggle with the effects of morning sickness, particularly in that first trimester of pregnancy. And it's made me actually consider whether or not her state of nutritional ketosis, or ketosis as a result of her nausea and vomiting, may in fact be safe. So I went to look at that literature, and I found out that we may in fact already have the answer to prove that a ketogenic diet and a state of nutritional ketosis is in fact very safe, and in fact may be the optimal diet for life itself. So we're going to consider that and the results according to what actually happens in pregnancy, and particularly women with morning sickness. So if I want to prove the safety of any intervention, ideally I want to do human trials and not animal trials. And ideally I want to do them on the most susceptible humans, and that's in fact the growing child. And the most important phase of growth is that first trimester of pregnancy, and therefore this may prove to be the perfect group to actually consider. Ideally, I'd like to involve large numbers of, shall we invite and call them participants into that trial. And I'd like to look at firm endpoints in a controlled time frame, and to actually have good follow-up. I'd like to be able to reproduce those figures. I'd like to do this in multiple centres. I'd like it to be published in peer-reviewed literature, and to be reproduced from country to country and also over time. So what do we know about the state of ketosis in pregnancy, newborns and infants? And it's actually a normal situation. It's critical in the growth patterns, and it's well and truly observed in women who are fasting. And when tested, it's present on the newborn child, the infant, and certainly even those first couple of years. The longer a child fasts, the more likely they enter into that state of ketosis, and that time frame is very short in the newborn and infant. All stages of growth utilise ketones, and obviously it's been a safe state for millennia. And clearly ketones are required for growth, particularly of the brain. So pregnancy gives us an interesting time frame. We know that it's a very critical development period for the child. Maternal nutrition is clearly important, and there are well-documented results in the literature that involve large numbers of patients. Complications are well documented, and there's good follow-up through to childhood, and those papers are in multiple forms and in peer-reviewed literature. So what endpoints should we be looking at? Well, I think we should be looking at birth defects. That's going to be obviously the most severe. We should look at miscarriage rates, whether or not a woman can get the pregnancy through to normal end of confinement. Birth weights can be well and truly documented, and so can pregnancy complications. And in fact, there's literature out there looking at the childhood development after pregnancy, both with intellect as well as general health outcomes. So pregnancy is often complicated by morning sickness, and particularly in that first trimester. It's otherwise called nausea and vomiting of pregnancy, or NVP when you research the literature. Very common in that first trimester, and with up to 3/4 of women being affected to some degree. When you are vomiting and you have nausea and you can't eat fully, then you do end up in a state of ketosis, and that's well documented with urine ketone studies and testing on a regular basis. If we look at the other extreme, which is gestational diabetes, then it's also becoming an increasingly common problem, and there's good literature looking at the same endpoints in gestational diabetes and in fact women who have diabetes in that first trimester of pregnancy. That state of diabetes is a state of increased maternal and placental glucose load to the developing child. So we can look at all these endpoints and consider the state of ketosis versus diabetes in all of the endpoints. And as it turns out, we'll look at the ketogenic diet or the state of ketosis first of all. Birth defects are generally significantly reduced in comparison with the normal population. Miscarriage rates are much reduced, and the majority of women get through to normal confinement without problems. Birth weights are generally normal. Pregnancy complications are reduced. As it turns out, when it's being looked at in small studies, childhood development is actually greater with these children in their infant years being more intelligent than their peers with less health problems. If we take the converse state and actually look at what happens with these same endpoints in diabetes, well, as it turns out, birth defect rates are significantly greater in those women who have diabetes through their pregnancy, and particularly the first trimester. Those complications tend to be non-chromosomal. That means they're environmental. So that is actually related to the state of the pregnancy, not the genetic predispositions leading into it. Miscarriage rates are significantly greater in women with diabetes through their pregnancy. They often don't get through to full-term confinement. And birth weights can be either very high or much reduced. Pregnancy complications are clearly higher. And as it turns out, when you look at these children in development following on, they often have poorer cognition with higher rates of attention deficit disorder, and those results are coming out in the literature as we speak. Childhood health problems are greater, and with higher rates of ongoing obesity and diabetes. So the results are actually quite clear when you start looking at the literature. So does this provide proof that a state of ketosis is safe in pregnancy? Well, I think it does. We have human studies, and particularly we have them on children and developing children. We have very large numbers with solid endpoints. We've got reproducible literature that goes across countries in peer-reviewed literature. What conclusions can we draw? Well, it appears that a state of ketosis is safe at the critical development periods of life. It appears to be safe for the fetus and the babies, and by definition, therefore, it's probably going to be safe for children and adults. Can we work out what that safety comes from? Well, is it a state of low glucose or low insulin? Or is it a state of low glucose or an increased ketone environment? I don't think we know the answer for that at this point in time. But for those women that end up in a state of ketosis in their pregnancy, this appears to have no detrimental outcomes, and in fact, probably improved outcomes for the developing child. Is it the optimal diet for life? Well, just maybe. These observations are not an endorsement of women taking up a ketogenic diet in pregnancy, but for those women who end up in that state for one reason or another, it seems to have beneficial effects and is clearly a safe option. There are multiple references regarding this when you start looking for them. We've actually got tens of thousands of results that are out there in the literature right now that can be looked at, followed up, and be added to as time progresses. Thank you very much. I hope you consider this in a careful fashion.